And here we go. Hi, my name is Dr. Shelley Cooper. I'm CEO and founder of SureShow and the Come On Now platform. SureShow replaces no-show and late cancellation medical appointments with billable telehealth visits. The reason I created it is after the untimely death of my father, we were looking for a way to get in to see doctors earlier, easier, in a more convenient way. So I created an app that replaces that no-show time with telehealth visits for medically fragile patients like my father. And it's geared toward hospitals. Hospitals were our market. Just recently was approached by HRSA. Okay, here we go. So here's what's happened. 1 in 4 medical appointments are no-shows. Not sure if you're familiar with that statistic or not, but that's a lot of discontinuity of care for patients. It's also a lot of lost revenue for providers. $16 billion of lost revenue, as a matter of fact. So with the SureShow platform being inserted there, we do increase continuity of care and we do recoup lost revenue. But due to COVID-19, HRSA is the Health Resources and Services Administration department of the federal government, noticed that there are several families who weren't bringing their children in for early wellness visits. So these children were not kindergarten ready. So we pivoted from SureShow being marketed to hospitals to Come On Now platform, which invites those families to bring their children in for the early wellness visits. And you'll see here, my wonderful daughter, I wanted to use her in the slide. So this is what the user would see. This is what the families, the parents would see. So how does it work? Patient books an appointment and the appointment is a no-show. That person is a no-show, but the Come On Now platform invites those patients and parents to bring their children in for that early wellness visit. When that no-show happens and that appointment is taken by that family member, they're able to schedule faster and get that continuity of care that they're looking for. So this is what our user screen looks like. And these are the partners that are working with us: Mid-America Regional Council, Head Start, SWOPE, and also Vibrant Health. So when the screen appears, the parent enters the information about their child, and this to the right here is what the finished screen will look like. And that's also one of my children. I wanted to make sure I put them in there. So you may think, well, how does this work? You may wonder, how does it work? Very, very simple. At the doctor's office, the doctor schedules in the visit. That's a telehealth visit. Lily's got a sore throat. How can we get her in to be seen sooner, as well as her early wellness? And this is what we do. And you may think, well, is this just a regular scheduling platform? Of course it's not. It's also interoperable with 96% of EMRs, or electronic medical records, HIPAA compliant, as well as secure. The competitive advantage for Come On Now, it beats out several other of the competitors, namely providing immediate on-demand telehealth encounters. The market is huge, $2.2 billion service addressable market among the federally qualified health centers. With that in mind, our go-to-market strategy is to start in the Midwest, in our own backyard, spread outward, so that by phase 5, which is 5 years down the road, we have hit about 32,000 facilities. We've got quite a bit of traction going here, 3 signed active contracts, and these are revenue generating contracts, and 2 issued letters of intent. This is our team, more than qualified, several years of experience for me, and then our dev team, developers and patents have been accomplished and issued, and we've got here our advisors that fill in where we need that help. So what do we need right now? We need introductions to financial decision makers at hospitals and federally qualified health centers. And thank you for your time today, and I appreciate any type of questions you might have for me.
15 seconds to spare even, so
yes.
Outstanding job. So are there any questions for Dr. Cooper? And I may have you, if you don't mind, stop your screen share. So
sure.
John can bring his up, so we'll be ready to go.
have a question if there aren't any. Dr. Cooper, fabulous. Love the Come On Now name, and great presentation. I have a question. When you create this healthcare platform, what are the security measures that you design for that user experience, or what needs to be taken into consideration for the user base as you're building out something like this?
And thank you for that question, because with any type of healthcare app or any type of interface where we're exchanging healthcare information, we've got to be very, very vigilant about our security measures. It's very important that we have two-factor at least authentication, so that we sign in and then we have a second sign-in step. We also want to make sure that we have an idle timeout, so that if it sits idle for more than a certain number of minutes, it automatically times itself out. We also are looking at, we have to host it here in the US. That's really a requirement. We've got quite a bit more control over that at this point, as well as making sure that our dev team is up to par in putting in all of the security measures that will make it qualify to apply for a HIPAA compliant status. We are trademarked, as I mentioned earlier, which means we've got that IP covering there. And so what we're looking to do is really make a cohesive step between interfacing with the user, who is the parent, to the provider at the doctor's office with no chance of breach whatsoever.
There was one question in chat, if you can give a 15-second answer. That being was, is Come On Now a pivot, or is it a separate product that you're doing from SureShow?
Great question. It started as a pivot, and now that we've seen that federally qualified health centers are looking for this product to increase access to care and to overcome social determinants of health, we have the Come On Now product for FQHCs and the SureShow product for hospitals. Two products.
Okay. Thank you, Shelley, very much. It was a great presentation.